Thursdays. I'm very happy you were able to join us for our presentation on the Family Medical Leave Act and the Americans with Disabilities Act from an employer's HR perspective. Having worked in human resources management for the past 20 years, our guest speaker, Lynda Anderson-Casey, will speak on the rights that employees have for job protection and career assistance from their employers when dealing with a mental health condition. Lynda has a master's degree in employment law studies from ASU School of Law and is currently conducting dissertation research on employees with serious mental illness as a part of her doctoral studies. This is awesome. Lynda first joined NAMI Ohio when her child was diagnosed with bipolar, and her daughter is now 22 years old. And Lynda strongly feels that it's important for employees to understand their rights to care for their own health and that of their family members, and even more so now during this pandemic of COVID-19. So with that, I would like to turn this over to Lynda to get our presentation started. Welcome, Lynda, and thank you.
Oh, thanks, Letitia. Wonderful. And I have to add on to, since that introduction was written, we've now got another law that we've been working through, the Family's First Coronavirus Response Act. So I've updated my presentation to add the FFCRA, and it's just another way that human resources has to learn to maneuver through so many legal and administrative regulations that the government puts in place. So I'll start with a disclaimer in that I am not an attorney, even though I went to ASU Law School. I only studied there for a master's degree. And so I'm not a Juris Doctorate, did not take the bar exam. So nothing that I'd have to say today is or should be considered legal advice. I'm just simply coming in front of you as a HR practitioner, trying to help educate both from employer's perspective, but also the employee's perspective. Because in my years of working with employees, what I've seen is that I don't think employees understand just how many rights they actually do have to get help from their employer to maneuver some of the conditions that we find ourselves in. Mental health, statistically, you all are well aware from NAMI that what those statistics are, that 1 in 4 or 1 in 5, depending on which organization you're looking at and what populations you're looking at, people will have some type of serious mental health challenge in their lifetime. And according to Harvard, about 18% of workers in the US have serious mental health issues. And so we bring our whole selves to work. And because of that, sometimes we're impacted in our jobs by some of the challenges that we have. And as you mentioned, I have a daughter with serious bipolar disorder. She's now 23, so she's had a birthday since then. And I know for her especially, she tends to just quit her job instead of trying to work with the employer and get some of the legal protections that she's entitled to. And there's a lot of reasons for that. There's a lot of stigma still about coming forward with your challenges that now, though, I think with coronavirus, maybe more people understand that anxiety and depression can happen to anyone at any time for lots of reasons. And so I'm really hopeful that what good comes out of this whole virus situation will be more freedom from people to come forward and express that they're having these challenges. So I wanted to really just talk tonight with you from an HR's perspective, some of the things that employees should know about if you don't already, and as advocates too. So for my daughter as a parent, there's times where she can't advocate for herself. And so hopefully if you can understand the rights of your maybe child or someone you're caregiving for, family member, friend, you could come forward on their behalf. If you are given permission by we'll just say the employee to do so, then human resources personnel should be able and willing to talk with you on behalf of the person that you're advocating for if they're having struggled to do that. So just wanted to make sure to mention that to you, and I'm going to put my glasses on today so I can read what I am saying. But as you probably are aware, in the past, on our next slide here, I am showing just a few of the different laws that have come into place over the years. You're probably very familiar with. 1990 was the Americans with Disabilities Act. And that started out very what's called narrow from a legal perspective. It didn't have a lot of breadth to it, but it was amended all the way up in 2008. It was amended to become much more broad, and we're going to talk about it in depth in just a minute. We're also going to talk a little bit about the Family and Medical Leave Act, which was implemented in 1993. And then here in Arizona, there's a specific paid sick leave law. The Arizona paid sick leave law was enacted in 2017. And that's not the case in a lot of states. Not very many states have any paid leave available to employees, so Arizona was one of the first to implement that. And then, of course, as we've just discussed the last few months, and the reason why we're on this video call instead of in person is this coronavirus. And so I want to talk about that as well, because these are all interacting. On the next slide, you know, the ADA, the FML, and the Arizona paid sick leave always kind of have interacted together. And I am also going to just mention, but I'm not going to talk about it tonight, workers' compensation. So if someone is having an injury through their employer while on their job, doing their job duties, there could also be a workers' compensation kind of interplaying in here, but I didn't want to spend too much time on that because it's you know, a little bit less relevant to people that are having mental health conditions. Usually a workers' comp injury is going to be, you know, something physical that happens to them. So and then again, those laws always were in interplay, but now we've also added on my next slide, you know, COVID-19. So the next slide is just representing that as of April 1st, we have now another law to interplay with. But I would note that this Response Act is only valid or in effect until the end of this year. So that's one thing to keep in mind, unless of course it gets extended, and that could always be possible that would happen. And feel free to, if you have, you know, questions to ask. I will pull up the chat here so I can make sure that I see them. Or if you want to, you know, interrupt me, I'm happy to stop and have a conversation, as we would probably more of if we were together in person. But I want to first talk about the ADA. So the Americans with Disabilities Act, on the next slide, that prohibits discrimination against qualified individuals with a disability. And so it requires not only employers to not discriminate, but it also requires an employee to provide reasonable accommodations if needed for a person who has a disability, as long as it doesn't put an undue hardship burden onto the employer. And one of the kind of misconceptions, and I'm speaking from HR because I've had to learn, I will just confess that I was not near educated enough about these laws as a practitioner until I actually had employees come forward and start to work through some of these issues. When you're in school, as you probably know, you kind of read things in textbooks and you take tests and you know these simple definitions, but to actually work through it with a real person and a real scenario, it's very different. And so I have to say, as a profession, I think HR is not giving near enough the tools, at least in the educational programs that we go through. That's starting to change, and that's a great thing, and that's part of why I'm doing the dissertation work that I'm doing, is to try to focus in on how crucial it is to educate HR Because if they don't understand it and they don't know the law, how in the world, are the employees and the employer as a whole entity ever supposed to be able to offer the rights that Congress has given employees? So that first right was under the ADA. And so the things that you have to think about, next slide if you don't mind, Marissa, that an employee or an advocate for an employee needs to think about are these questions, because what happens is people kind of know there's some kind of law and there's some kind of protection, but they don't necessarily understand it well enough to know if it applies to them or not. And so the first thing is, does the law apply at all? So with the ADA, the number of employees that an employer has to have is 15. And therefore, so a lot of people who maybe work for a very small business may think they can apply for protections under these acts, but they have less than 15 coworkers, so they're actually not covered by the law, and so therefore the employer doesn't have to go through these exercises. So that's always the first question when you're advocating again for someone, perhaps, or caregiving for a child again, or a family member. You need to know how big the employer is that they work for and whether they are covered or not. So say there is someone that works for an employer that is larger than 15 employees, then you have to look at, does the employee themselves or the patient with the mental health condition undergoing treatment or whatever they need, whether they are qualified to be qualified under the law. So the ADA defines someone with a disability as either a mental or a physical impairment. So see, all these words in laws, they make very very specific wording. So you have to look at all the specific words they use in the law. So impairment, that substantially limits, so there's another very important word, substantially limits one or more major life activity. Another very important set of words, what is a life activity? So you have to go through that exercise. This is what HR should be doing if an employee comes forward and says, I need to get some help, and I believe I'm covered by the Americans with Disabilities Act. The HR department is going to be going through these questions and may need information from the patient or the family member to be able to make these determinations. So the first one they're going to say is, what is the impairment? So it can be physical, as we've talked about. This picture shows a gentleman in a wheelchair. So obviously he has a physical impairment where he, cannot walk the way that other people do. So in a physical impairment, or in the case that we're talking about usually with NAMI, would be some sort of mental impairment, either due to psychological disorder, or even a mental such as Down syndrome or something like that, autism, a physiological mental disorder. So they have to look at what is the impairment. And there's the expanded part of ADA in 2008 really opened up a whole larger box of qualifying conditions. So in the very beginning, back in the 90s, the early 90s when this was passed, it was very much about physical disabilities, deafness, blindness, not being able to walk, that kind of thing. But over the expanded definition now, things can be cerebral palsy, epilepsy, multiple sclerosis, cancer. Cancer can be a disability, diabetes, heart disease, even as far as drug addiction and alcoholism. So that's one question that comes up a lot. While a person is actively using, say, illegal drugs, they are not covered as under the ADA, but if they go into treatment. So once they are pursuing treatment to recover from addiction, then that becomes a condition that they would qualify under accommodations under the ADA. So these are the kind of things that people have to talk through with their employer, and so the HR department is the one usually that will lead that kind of conversation. So the employee does not have to talk to their supervisor. That's one thing they should know. They can, if you're comfortable with that, but a lot of times supervisors are not aware of these particular laws. The training that is done is not always the best. Again, I'll be the first to admit, I think managers do not always get the best training from HR, because again, HR doesn't always understand. Yeah, and you don't encounter too many of these situations, given the statistics that we talked about. It may be the first time that an HR person has had a situation come up, so they need to educate themselves, or it's been so long. It doesn't happen, every day. So also back to then the impairment that you have to talk about is, does the impairment actually limit their major life activity? If it doesn't limit it, it's not a disability, and therefore they aren't entitled to protection under the ADA. And so those major life activities include walking, seeing, hearing, breathing, caring for someone, sitting, standing, lifting, learning, thinking, working. So I have, a lot of my particular cases that I've had with employees over my career have been around the attention deficit disorder, for example. So the ability to think and learn in the ways that employees typically are given training might not work for some individuals. And so that is something HR needs to recognize, or a supervisor needs to recognize is happening, because employees are not required to come to HR or to the supervisor and say, I have a disability and I need an accommodation under the Americans with Disabilities Act. They are just required to express that they're having struggle. It's up to the employer to recognize that this may be a dialogue they need to have. So it's always best, I would highly recommend, if an employee or their caregiver or advocate sees that they need to approach HR, that if they can say these words, you're going to get their attention as someone from HR. If someone comes to me with those specific words, I'm going to immediately recognize the issue, versus what typically more happens is just a supervisor will say, Joe Smith is having problems following instructions or something like that, right? So it's not clear always. So it's our job as HR professionals to spot these kind of issues happening and make sure that we are performing the discussions that need to occur. And I find from my work as a consultant that I've been doing the last year and a half, HR does not necessarily do a great job at spotting those issues and in triggering it in their head, much less supervisors. So that's why I think it's so important that employees understand their rights, so they can speak the right language. Because as soon as you say those words as defined by the law, then the brain triggers, right? Then the HR goes, oh, wait, okay, they're asking for an accommodation. So then the third thing, again, that has to be substantiated is whether the life activity limitation is substantial enough. So not only does the person have to have an impairment, but it has to limit that activity substantially, right, for it to be qualified as meeting the definition of a disability. So and these are things that, unfortunately, you have to do a case-by-case analysis. That's what's so hard about HR sometimes, is people think that that because one person got this thing that it always applies that way, and it's not the case. Each person has to have a specific dialogue individually with HR, and so that is very important that we, sorry, little interruption there. Very important that people realize that it is a individual specific analysis. So not a one size fits all, I guess is what I would say. And then I see Lenore has asked a question. You think people are afraid to disclose addiction? I definitely would think so, yes, for sure. But what employees need to understand, and or caregivers or advocates, is if they do not disclose it, HR has no obligation, or the employer has no obligation, because they don't know about it. So it's one of those catch-22s, is employers can't be held responsible, sort of like along the same lines as sexual harassment. They can't be held responsible for something they don't know about. And so it unfortunately, does require an employee to come forward, and or the employer to have enough information to spot that there is something going on that's potentially, a disability or a serious health condition that we'll talk about in a minute under the FML. So yeah, I do think people are very afraid because it's been stigmatized. But again, I'm hopeful that with how much mental health issues have been coming out due to this coronavirus, that this will really be a shift for employers and employees to be willing to talk more openly about the challenges that come out for different reasons. And that's the one thing I can hope for, I think, out of this whole pandemic that we're working through, that it will become less stigmatized. And so just not every kind of situation rises to the level of a disability. So for example, say a broken arm. A broken arm under normal circumstances wouldn't be a disability because it's temporary, right? So it's short duration, it's not really that limiting, and so it may not rise to that occasion. I had rotator cuff surgery, for example, and that is not a disability. So if it's a more temporary kind of thing and can be fixed per se, then you tend to not have a disability there. But definitely back to the kind of mental health conditions that we're focused in on tonight. Usually pretty much any serious mental health condition that is of a substantial amount of time will qualify. So for example, depression, right, could be for sure, because it can last months, years. It affects people's ability to concentrate, to sleep, that kind of thing, and especially it interferes sometimes with people's ability to interact with others. And that's where I usually tend to start spotting issues with employees, is when there's not the best interactions going on between coworkers. And when you start digging in and having this dialogue that's required, you trace back to see that they're having some kind of mental challenge, and are usually in treatment, some kind of physician, and that's where we start down the road of potentially a disability. So let's see, make sure I got everything. So then the big question becomes, what kind of say they are qualified under ADA, what do you do from there? So what will happen is the HR professional should provide the employee with doctors, what's called a certification process, where the physician will write out in a form that's available. All employers pretty much use the same forms usually, because they're produced by the governmental agencies that monitor these laws, like the EEOC or the Department of Labor. And so they usually all look pretty much the same, which is asking what the employee, what the needs are, what kind of accommodations would work to help the employee to do their job. So, take a physical disability like deafness, right? Accommodations would need, they may need closed captioning, transcription services, telephone, T2Ys and things like that. And those have been typically pretty, I guess, easy in a way to understand the needs for. I find with mental health, it's harder to understand what it is that the employee might need. And so that's really where working with the employee to find out what would help the most is what's called interactive dialogue. So the employer is, it's on the employer to have this dialogue with the employee. And a lot of times, for example, one case I remember, the employee just needed to not have to sit in like in a conference room, if you're in a meeting with 10 people, she needed to be kind of off in the corner by herself. She just needed her own space. And that helped her to have better interactions with her coworkers if she could have that physical distance. And that was certainly an easy accommodation to make, right? So the undue burden or undue hardship, that is a very high bar that is set by the government. Most employers have to give the employee the accommodation that makes sense, even if it costs money, and even if it costs quite substantial amount of money. That's the thing I see the most is, you know, employers are trying to always manage costs and things, and they'll say, well, you know, that's too expensive. The government doesn't really care, frankly, how much it costs the employer. They want employees to have jobs and be successful in those jobs. And they really set that bar high as to what would be undue hardship and too expensive. It's really, I've never seen yet in my career a case where the employer didn't have to spend whatever money it took to get the employee the things that they needed, if the employee understood their rights. And so that's why it's so important, because it really is in favor of the employee if the employee understands that they have those rights and is an advocate for themselves. That's what mostly I wanted to cover. So you know, how the employee applies for them, they go to HR. You again don't have to go to your own manager. In fact, I think it's easier if you go straight to HR. And if you can use the words that I believe I have a disability that would be covered under the Americans with Disabilities Act, and I need an accommodation or some accommodations. If you say those words, that should get the attention of the HR practitioner. And again, as long as there's 15 or more employees that they're covered under the act, you will maybe have to be forceful. So there's information out there, right, on the internet. You can go to, in fact, the next slide, Marissa, I think I put the Job Accommodation Network, and I'm sure you guys are all very familiar with that website. That's what JAN stands for, Job Accommodation Network, askjan.org. And that is the best site that I've found to help both the employee and the employer think of creative ways to help, because that was the challenge early in my career, was JAN did not exist, I don't believe, back then. And, you know, HR doesn't know, we're not doctors. We don't know how to, or, you know, work advocates, we don't know how to make the accommodations that an employee might need. So JAN has been very instrumental, and especially the past few years, with helping employers and employees to come up with good ideas on what might be helpful. And I see Sonia's asking, let's see, what happens if the employee does not disclose their mental health condition and was triggered by another employee? Can they start the ADA process? Yes, so say for example, an employee was already in discipline because maybe they had an outburst. So I've had this happen, you know, got upset because they were having great anxiety and someone triggered them and they, you know, yelled at the other employee. The employer is entitled to still continue with discipline for something that happened pre them knowing, right? But so they may go ahead with discipline at that point of, you know, whatever they write up or what have you. But then you can also ask for the accommodation to start the interactive dialogue process. So it doesn't stop the discipline, but it should at that point start the conversation to, you know, make it a better work environment for everyone after that point. So, and that's what happens a lot, right? Employee does not disclose anything's going on. Employer has no idea. Something bad happens, and employer may even be to the point that they terminate the employee. And so that's the case where if the employer knew nothing about the need for any accommodation, they usually won't be held responsible for terminating the employee because they didn't know what they didn't know. Let's see here. So I think, so Jan, for sure, and I know you guys would know that resource often, but I will tell you, I was at the Society of Human Resources Management is our association that we belong to, HR professionals, and they had a luncheon. This was pre-COVID. They had a luncheon late last year with the head of EEOC here in Phoenix. And excuse me, she mentioned, more than mentioned, made it very clear actually, that she said that if employers, if someone's charged, if an employer is charged with a violation of not accommodating someone under the ADA, and the employer did not work with Jan before they let the employee go, or whatever got them to the point that they were being charged, they would presumably, EEOC would presumably go ahead and fine in favor of the employee. So that was a real eye-opener for me, and I think a lot of people in the room as HR, because Jan has always been a good idea. It's always been a good place to go, but it was never that strongly put out there before that that the EEOC may find against employers if they didn't work with Jan. So they were very serious about it, and as it should be. And so I think that's just something that I would add, that you employees that need these accommodations have the EEOC in their court for sure. Let's see here. So back to the interactive dialogue, though, you just have to make sure as an employee that you are not the one that hasn't responded. So if you can think of the interactive process as a ping pong, like tennis match, back and forth, the employer, should say, what is it that you need? And then the employee says, I need this, this, and that. And of course, doctors' certifications will go along with this. I mean, employers usually aren't going to just take an employee's word, although some will. I have worked with some employers who are just like, whatever they need, I'm going to make it work. I'll give that to them. It's fine. They don't even need to have doctor's notes. That's not been usually the rule. It's more the exception. But it's kind of nice when you do meet an employer like that. But it's a lot of times it needs that paperwork because you kind of start setting a precedent, right? When you do for one employee. So a lot of times it will need a doctor's backup, as proof, kind of thing. So you just want to make sure that the employee is not the one that's dropping the ball. Because I do have that happen a lot where, we start the interactive process, we talk about things, and then the employee never gets the doctor's paperwork back. Although the employer should remind them that they need it before they do anything negative to the employee. But just make sure the ball doesn't get dropped on the employee side if you are helping someone through as an advocate for them. And employers do also have, rights to get other opinions. So usually you go with the employee's doctor's opinions, but I have had a time or two where it wasn't sufficient or it just wasn't the right doctor. And so employers can ask the employee to go to their own doctors, and as long as they pay for it, the employer pays for it, right? So that's not something that would be unusual to get a second opinion. And you can even get a third opinion if you're still disagreeing about it. But that is pretty rare. That I've only had maybe one or two times in my whole career where we had to have another doctor brought into it. So, okay, so I'm glad that helped. Lenore, sounds like we're familiar with Jan, so that's definitely a resource I highly recommend. And if you don't have other questions, let's move on to the FML, so the Family and Medical Leave Act, which is that entitles employees to take up to 12 weeks of unpaid leave. for family or medical reasons within a 12-month period. And so one thing to understand about that, for some reason, people very much get confused that they think there's pay with the FML, and that's not the case. There's no pay, you know, unless an employer has a different kind of paid policy. So sometimes employers, you know, will have paid time off banks or sick time or that kind of thing, but those are separate programs. They just kind of intertwine together, so that can be confusing for people. And so, as always, too, the next. Before I go there, the 12-month period I did want to mention. 12-month period is defined the way the employer defines it. So there's a few options for how employers can define that 12-month period. They can do it by calendar year. They can do it by, say, when the very first time you need FML and then go forward. They can also go rolling backwards. And so that's what most people do, or most employers that I'm familiar with do a 12-month period that measures backwards from the date that the employee starts to use any FML leave. And so that can be confusing for people sometimes too, as to when that 12-month period runs out. And then leave can be taken in that whole block. They could do 12 weeks at a time, which is often the case, say somebody has a baby, or you can take it in intermittent pieces of time. And usually the minimum amount of time that your timekeeping system calculates or records, say 15 minutes or half an hour, that's the amount of intermittent time that you can, that you should be counting. So that can give you a lot of time off when you take it intermittently over a whole year. And one thing, again, back to, okay, the next slide, Marissa, the same questions, right? As does the law apply at all? So I don't know if anybody's familiar with how many employees, just in the chat to keep it a little interesting, are you familiar with how many employees that the employer has to have in order to be qualified to abide by Family Medical Leave Act by chance? Anybody know? 6? Good guess. No? More? It's like higher, like Price is Right, higher. It's actually 50 employees, right? So that's always the first question to ask, is that employer have 50 employees or more? And they also have to be within a 75-mile radius of each other. So say they have multiple locations in town. If they're within 75 miles of one another, and they add up together to 50, then that will qualify them for also 20 or more work weeks in the year, the current year or the preceding year. Because that my very first HR manager job, we had 49 employees, and then we finally hired the 50th. And so I had 20 weeks then to get my act together to learn the FML so that I could start to administer it correctly. So that does catch people sometimes where they are right in the middle of, oh, they just went to 50 employees. So they'll be covered eventually after 20 weeks. If you're a private employer. If you're a public employer, say like a state college or a government agency, that is every employer is covered if they're public employers, no matter how many employees you have. So that is another key difference to know if you're trying to advocate for someone, is whether their employer is a public employer or a private employer. And if they're public, are they a government, federal government, or state government? Because different laws apply to federal governments agencies than state government agencies. So it can be kind of hard to know. So then you have to ask, right, does the employee qualify under the law? Right? So not all employees can get FML even if the employer has 50. The employee has to work for that employer for at least a year before so they have a waiting period before they're qualified. And they also have to be what's considered full-time employees. So that means that they have to work 1,250 hours or more in the previous 12-month period to be covered as an employee. And, you know, so that sometimes, literally I've sometimes had to add up hours for people to find out if they hit that 1,250 hour mark or not. And so you have to make sure that they qualify under the law, right? And then, oh, I will mention though, the employment doesn't have to be consecutive. So if they've like had breaks in employment, so I've worked at community colleges and universities a lot. So you'll have like adjunct employees who work one semester and then don't work the next semester, and then they work the next semester, and that kind of thing. So you have to look back and see if they've worked that much time within the last 7 years. So it doesn't have to be continuously 12 months of employment in a row. Let's see here. So the reasons why would you take, what are the qualifying family conditions or health conditions? It can be for the birth of, we talked about childbirth, so a birth of a son or a daughter, right? Or an adoption type of situation. It can be to care for themselves, for their own serious health condition that is affecting them, or to care for their spouse, son, daughter, or parent who has a serious condition. Not a parent-in-law, not an in-law, but your actual mother or father, son or daughter or spouse. And then there's all kinds of things around military that I'm not going to go into. That's a whole nother subject, but military service members have a lot of other additional things that they qualify for under FML. And so we talked about that you could take the whole block, or you can take parts of blocks, or you can take intermittent time. And so the one thing that employees should know about that is you're supposed to, if you have notice, if you know you're going to have a surgery, you're supposed to give the employer a 30-day heads up, if at all possible. Because I try to think about the employer side of it, right? They're trying to get their work done and their customers taken care of. And so, you know, heads up is nice, but that's only, of course, if the employee can give that heads up. But hopefully most of the time they know if you're going to have a surgery ahead of time, or a baby, for goodness sake, that you can give them that notice ahead of time. Let's see here. And as I mentioned, you know, sometimes you already have paid leave available to you, so you can add it on top of that protection, the FML protection, and get some of that paid, maybe even sometimes all of it paid. In fact, the federal government did, under President Trump recently, start giving paid leave to childbirth for federal employees. So it does happen sometimes. So again, same kind of thing as we talked about the ADA. If the employee has the need for it, you know, go to your HR department. Again, if you feel comfortable going to your supervisor, you can do that. The supervisor should then go to HR, but I find it more effective to just go straight to HR, because they should know a little bit better about these laws and help to work with the employee. And there's forms, again, every administrative government body has put out certain forms that they want employers to use. So you would, same with ADA, the employer will give you a doctor's certification note to get from your physician filled out and returned. There's time frames around that, usually like a 7-day window, and get it back. That's where I see also employees fail to respond, right? The employer gives them the forms, and then the employee doesn't give them back. And if you don't give them back, then the employer can't help you, and you aren't covered. So that's really important to follow through all of the administrative pieces. And every employer who's covered, if you are able to get a hold of the employment manual, the handbook, so say you're trying to help your child or someone else, a lot of times the handbooks will be available online at the employer's site, or they'll have a physical copy of it. These notices are supposed to be in the handbooks by law, so you should be able to read from the employer's perspective all the things they expect that the employee do for these certifications and things. Let's see, and so on FML, I did want to mention the employee, say they take that block of time off, they're entitled to get their job back, usually their same job back, their original job. And if it can't be for some reason their original job, they're entitled to something as close as possible to their original, very substantially similar job. And so that's something that employees should know and not have to worry about. The ADA is a little less specific about that, but similarly, they try to give you back the job that you had or one very similar to it. And then also on benefits, for example, health insurance. If someone's on FML, they are entitled to be on the same medical benefits as if they were still working. And so an employer can't, stop paying their part of the insurance or something like that if someone's on an FMLA leave. So that's a nice thing to have, because people are having mental conditions, usually are needing treatment, and so they need their insurance that at that time more than ever, right? So the next slide, Marissa, I think, is just a couple of things I would mention about things that I've seen employees get confused about. The first one I've already hit, it's FML is not paid leave. Those are two separate things, but they do intertwine together. Employers do have the right to know why the employee needs off. So say you have established that you have FML rights and you've done your paperwork and you're covered, and then you call in. You do have to, as an employee, tell the employer why you're calling it if it's for your FMLA. So because I've seen employees, call off for their dog is sick, or their car is broken down, or the numerous things, right? And so the employer has to record what is FML time and what is not FML time because of that 12-week balance, right? And so the employer has to know, what it is that is the reason why you're out that day or for that hour or what have you. So employees sometimes get, I guess, defensive or form an attitude of like, it's not your business, but unfortunately it is for the employer, it is their need to know for that, for the reason of keeping track of the balance leave, right? Another thing that comes up a lot is employees are out because, say they had surgery or something. The employer should not be calling that employee to ask them about work. And so that's making them work, and that's not FML. And so that's a thing that comes up a lot. And even though FML is job protected leave, it's not protected, say, if everybody is being laid off. So in this coronavirus world that we had, and everybody was being furloughed and laid off and whatever, people on FMLA can also be laid off or terminated because of business needs. So that's something that people get confused on. I also see this a lot, like, I saw so-and-so was on vacation in Mexico and they're on FML and they're supposed to be, at home doing nothing, I guess. But, especially mental health conditions, right? A lot of treatment is to, de-stress and get away from whatever triggers are going on. And so, yes, employees can go out on vacation. And then, but the very fundamental thing that I wanted to take away from that is FML is an absolute right. Unlike the ADA, where there's some interactive dialogue process that's required, the FML, if the employee qualifies for it and the healthcare provider certified it, they are covered by it, and the employer absolutely has to let that time be off. Employers don't like that sometimes, right? Because again, from their perspective, they're trying to get work done. And so it's disruptive, and it's, you got to find somebody else to do the work. But again, the government does not care that the employer has that burden. That's the Congress that passed these laws and presidents that supported these laws absolutely believe that the employer is big enough and makes enough money to be able to, handle extra workers when they are needed. So know your rights and take advantage of them. So that next slide here, this is a very good resource. I highly recommend. It's called the Employee's Guide to the Family and Medical Leave Act, and it's on that website. the Department of Labor's website. So anything you ever wanted to know about it is very simply laid out in very simple terms on that. It's a PDF file, a little booklet. And so, you know, make sure that your loved one or your person that you're helping has that. There's also one equivalent to that called the Employer's Guide. So the employer should know their rights and the law, but if they don't, like I said, HR is not always trained in these kind of things. A lot of times I cannot tell you how many people I've met that were just like the, you know, accounting clerk, and oh, now you're going to be HR, right? So they don't always get the training they need. So you can always educate them as well if they're not understanding what you understand your rights to be. And then the last few minutes, I wanted to talk about AZ paid sick leave. The next slide, that's pretty simple one, actually. In Arizona, workers, and it doesn't matter what size the employer is. So when you ask that first question of, is it a covered employer? Every employer in Arizona is covered. It doesn't matter their size. They have to let employees earn 1 hour of sick time for every 30 hours of work that they you know, accumulate, and then that's up to 24 hours of paid sick time for an employer who has 14 or fewer workers. If you have 15 or more workers, then you get 40 hours of paid time per year. And so there is a waiting period though on that. It's 90 days. So starting a new job, you'll start accruing that time, but you can't use it for the first 90 days, at least not paid. And sometimes employers can grant that too. Instead of making you accrue, employers can go ahead and just put the whole bank up front. And that's one of the rights under that. And so for that particular leave, pretty simple. You can use it for medical care, whether it's physical or mental, an injury, a health condition for yourself or your family members, a public service health emergency like what we're having now with coronavirus. So for the first time, Arizona actually had to use, or I mean, people had to use this Arizona paid sick leave for perhaps for these stay-at-home orders that we were given. Whoever wrote that law in 2017 foresaw the need for public health emergency to be added to that law. In addition, it also helps people who are having domestic violence or sexual violence, stalking, things like that can be used. Time off can be used under this law to go and take care of those kind of things. So even though it says paid sick leave, there's other things thrown into that law. And a few things on that are interesting. The employer can limit people from taking more than the 40 hours. So even though you accrue it as you work over time, you are able to, as an employer, limit it to 40 hours a year. And there's no requirement to pay out employees. So if you leave your job, the employer does not have to pay that whatever balance out. If they rehire you, they have to reestablish what your balance was though within 9 months. So I think next slide, Marissa, I already started talking about the law applies to all employers. There is a 90-day waiting period, but it does apply to all types of employees too. That's a question I get a lot. It does that Arizona paid sick leave, it doesn't matter what type the employee it is. They can be part-time, temporary, seasonal, any type of employee whatsoever. Doesn't have to be full-time. They get that time, 1 hour for every 30 hours worked. And same kind of conditions that you would expect under FML, like health condition or, as I mentioned, domestic violence and things like that. And then again, the interesting one I think about Arizona paid sick leave is that you don't have to tell the employer like the specific reason why you're using it, unless you miss more than 3 days in a row. If you miss more than 3 days, then the employer can ask what you're taking off for. But in this particular situation, if you're taking Arizona paid sick leave, you only have to say that to the employer, that I'm taking today off under Arizona paid sick leave, and they can't inquire. So that's that's an interesting little caveat there. The only one time that you don't have to tell them what is going on. And so the next slide is the resource that I would point people to. The Arizona Industrial Commission, in this case, is the one that governs most of the questions about this law. And so there's an FAQ, a frequently asked questions PDF, that is very long, but very informative. And so both employers and employees can visit that site if you have further questions. And then our lovely coronavirus, and I see I'm already at an hour, so I will just quickly go through and mention that the Coronavirus Response Act is for employers that are under 500. So if you're at a very large employer, I think the government thought you could already give enough paid time off to people. So it's 500 and less. Private employers. For public employers, it's any size for public. So governments, city governments, towns, things like that, it's any size employee base is covered. And it's only good through the end of this year though, unless they expand it. And there's really two parts. It's not too difficult, although the way they wrote it makes it very difficult, but it really isn't that difficult. The first part is basically up to 80 hours of paid time if someone were to get sick with coronavirus or something like coronavirus, or be quarantined because, say, they were on that cruise ship and they got stuck on the cruise ship. So that's 80 hours of time. And then the second part of it is to watch children who can't go to school because of coronavirus. So even though they made it a sick kind of benefit, they also threw in family care. So that confuses people, right? So it's also for caring for children under 18 whose child care is closed. And for those people who are taking it because of child care issues, it's only 2/3 pay. It's not full pay. It's only a 2/3 pay, but it's up to 12 weeks. So it's been a very interesting mix of how they threw in some of the stuff from Family Medical Leave Act and kind of mushed it all together in a way. So this, in fact, is the first time that there's been paid leave for families to take care of children. And so that's been a very novel new situation that hadn't happened before in the past. So same kind of thing, you know, again, you'd ask those same questions. I think I threw in that same slide next there about you've got to figure out, is the employer covered, right? And do they have 500 or less employees? And then if I'm the employee, am I covered under it for the different situations? And do I have the right qualifying condition, right? So I've had a lot of people, you know, somebody has pneumonia. They think they have coronavirus, and then they go to the doctor and no, it's not coronavirus, it's pneumonia. So they don't get the pay under the Families First Act. They only get paid if they have coronavirus. And so that's been very challenging to keep track for HR professionals of exactly what people are ill with. And that's why it's been very challenging, because normally you don't want to know an employee's diagnoses, right? You just want the doctor to tell you, yes, they should be off, or no, they shouldn't. You don't want to know what they have. But Families First has made it very difficult for HR, because in this case, to be able to know if they qualify, you have to know what their health condition is. So it really threw the world of HR and employment lawyers on their heads. Their heads have been spinning quite rapidly because this law really kind of went against what a lot of us have learned to be kind of the safe things to talk about with employees up to now. So it's been very interesting. And there are some exemptions, like healthcare providers and first responder providers are not subject to this law. So that's been very confusing for people, because who most likely is going to get coronavirus but these people that are on the front line, right? And so that's been confusing as well. And there is also an exemption if the employer decides to go apply for it if you have fewer than 50 employees. So that also may be a reason why they are not offering it as your employer there. So it's very extensive, and I won't go into it any further since we're at time, but I love, yes, Lenore, it's very complicated. You're right. So the last slide, I think that was the last slide there, is there are the 2 different sources that I really like. The first one is about the coronavirus specifically for people, both employees and employers, and the second one is more general because the DOL governs all kinds of laws that we aren't talking about tonight, like wage and hour, all kinds of different laws that apply to employers, and so that gives employees more information about things that you might be interested in besides health related specific things. So I just close with that next slide. It's really complicated, just like Lenore said. It's very complicated, and the laws govern for employees and employers. There's pieces that each party has to do in order for them to get their needs handled, and the back and forth, like I said, just don't ever let it be the employee who dropped the ball. And if it's the employer who's dropping the ball, then the employee has rights to go and file complaints at those agencies that we've talked about and get things resolved. So I try to remember, the employee needs their rights handled, and the employer is also trying to get their work done, have employees that are picking up the slack, puts a burden on, the team. So the employer really has to be prepared to manage that difference in productivity, and hopefully is putting aside money and resources to help all employees get what they need during times like this when people have to be out for their own health or the health of their loved ones. So. And Lenore, where should one go if they work in a small business without an HR department? So yeah, if you could try your immediate supervisor, but if you're not getting anywhere, the owners, especially if they're a private company, again, some of these laws really don't kick in until 15 or more employees, like the ADA, for example. So what I've found is if you don't have a large enough company to be covered by the law, just going and talking to, say, the owners. I've always found personally with my consulting work, the people that are private owners, small businesses, they seem to be much more willing to work with an employee who's struggling. I guess because they're so small, they're more of a family kind of atmosphere, and they seem to be much more amenable to letting employees get what they need, even though they might not pay for it, right? You might not be getting pay. And that's a whole nother issue that we didn't go into for tonight because it's too complicated, but you may have rights as an employee to fall back on a disability policy, right? If you have disability insurance through your employer or through the government, Social Security disability. So that's a whole nother topic for a whole nother night, but that's really what the employee has to weigh out. There's a time where the employee, when they can't work at all, they really have to go ahead and go the disability route, and not try to work. I've had many conversations with employees over the years where they keep trying to work, but they end up not making any money because they're off so much. Whereas if they would go ahead and pursue disability, they would at least have a regular source of income. And so it's a really hard conversation to have with people, but comes a time where it's time, if you know what I mean, to do that. And my daughter now is on disability and is not trying to work anymore at this point because it just wasn't working for anyone. So yeah, just being as forward as you can without having to divulge everything. You don't have to tell every little thing. You don't have to say what's going on specifically. You just need to say that you have a health condition that you're being treated for, and you need to have your doctor's paperwork to get your rights access to the rights that you know that you have. Yeah. Let's see, Lenore, learned a great deal. Great, thanks for sharing. And true disability may be necessary. Yeah, sometimes that is the case. Any other questions or thoughts?
This is Letitia. I have a question.
Yeah.
I'm remembering from a previous life, and I got two different answers. So, and you may have alluded to it. If somebody is on FML and they're contacted by someone that says, "Hey, can you do some contract work for me? Put together some grant proposals, and speak on our at our conference," different things like that. Is somebody allowed to do that while they're on FML?
Well, so for the employer that they're getting FML from, they should not be doing that, right? Because you're on leave for a reason, to take care of your condition. If it's another, so it depends. I'll give you, I hate to say this, but every HR answer is it depends, because you have to look at the specific scenario. So I can only generalize. But there could be a very specific key fact that would change that answer. But say you're actually caring for, a child with a serious health condition. That's why you're on FML. So maybe you have a spouse that at night they could care for the child. So at night you could do work for, say, another employer or something like that. So it really is very what's called fact-specific analysis. So it could be the case where you get one answer in one scenario and a different answer in another scenario.
That's what happened. Okay, well, that makes sense.
Yeah. Great.
Let's
Any
check
other questions?
I think Linda feels like you have covered it all, and thanks.
Yeah, sorry, and I'm sorry I did run over.
No, that was a wealth of information for sure.
Yeah, you could spend 8 hours on just one topic. It's really a lifetime of learning. Trying to simplify it down is not easy to do.
The life before mine with NAMI was spent with the state organization Vocational Rehabilitation. And so much of what you talked about used to be my world, and I can't believe how much I've forgotten. I mean, there's just so much I feel like I knew those numbers, I knew those kind of policies, and they just, if you don't use it, it's gone.
That's right. Exactly. Right. Yeah. Like I said, from an HR perspective, it doesn't come up that often. And so just making sure that as the employee or the advocate, what you think is right, talking to the employer and finding out, if they either aren't educated, doesn't know, or maybe there's a fact like, oh wait, no, they don't have 50 employees, that you wouldn't be aware of. Just find out why they don't think the person qualifies.
All right, well, let me check the chat one more time. I think we are full and have all these new resources to use. So Linda, thank you so much for your time and your expertise. And
welcome.
We taped this session because I actually know a few people that I can't wait to send the link to. So
great. I'm wonderful. And feel free to, certainly reach out with any follow-up questions or scenarios. Again, I can't specifically I'm not an attorney, not giving legal advice, but I can at least kind of steer you at least to the right website or further information, provide that.
Perfect. Well, thank you very much. And you all have a nice evening.
You too. Have a good night, everybody.
Good night.
Stay healthy.
You too.